Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is the Professor John Penisarada. Today, we're going to be talking to you guys about some signs that you do not want to ignore if you guys are going to be experiencing lower back pain. Now, lower back pain can come in all shapes and sizes and come on subjectively, so many different ways that we could be dealing with it. Now, over the last week or so, I've had a couple of patients that came into the office and they talked about some of the things that they had problems with when they started to ignore the lower back signs, and then 3-4 days later they come into the office and they're saying, I don't know what I did, it slowly started to progressively get worse. One of the first signs that they started to see is a hip translation. So you saw us walking in the beginning of it. Our hip translation over here, you're going to start walking almost like you're trying to lean away from the type of pain. Your gait completely changes. You notice that your swing, your leg swing changes a little bit. Or you even notice that your leg starts to get a little bit longer on one side. And because of that long leg on one side, your hip starts to shift over, or your joints may be a little irritated in this area, and you might be trying to lift your rib cage away from that type of pain. Now, those cause for postural exercises and exercises that help with decompression of those discs and activation of the spine. Check us out on another video, and that will help to get rid of those pains if you start to see a hip shift to one side. Another sign that you might see is, John, you want to show the shoulder one?
So aside from hip, now you could also see if your shoulder alignment is off. And a lot of times it might be in one side like so, or it's even rounded in one area, okay? And once that happens, it's connected to what Dr. Joe was just talking about. It might be with your hip, and now that's gonna later on potentially cause back pain. And so if that happens, a lot of times you'll feel the pain in the back, but it's actually the posture of the hip and the shoulder that's causing that back pain. So if you start seeing your shoulders off alignment, whether it's one side higher or one is rotated forward, then you could potentially get lower back pain.
Some lower back pain.
in the near future.
Yeah. Now, those are just some postural deficiencies that we may see. Again, as I said before, back pain may come in all shapes and sizes. If you're feeling soreness, it's a lot about it is feel. If you are struggling with any type of feeling tense, tight, achiness from sitting down all day long, and doing a sport or a traumatic incident, get it checked right away. If you can't figure it out on your own, get it checked. One of the main things that we like to focus on is, in order to fix that, is working on the posterior chain. And the posterior chain starts all the way back from my heels, goes all the way up to the back side, and goes all the way up through the neck. Those muscles might be attempting to spasm out, which is almost trying to help you to stand up straight. One problem will lead to another problem. We want to make sure that those problems are fixed before it leads to another one. So it's always a downward spiral if we start to see some postural deficiencies, some soreness in an area.
The trick about it, though, is a lot of people may not be aware that their body is off-kiltered, right?
Yeah.
Like, all of a sudden, they think they're walking normal, but if you look at it from an exterior point of view, they're actually unaligned.
Yeah.
And that, like Dr. Joe was saying, if you continue with activities, but you're still off alignment, that can potentially cause problems in the future.
Those imbalances can create a lot of problems. Yeah. So one of the things that we're kind of guiding in or touching base upon is our hip mobility. So remember, if I had a person walking up that hill and they're already shifted over to the side and they're swinging their hips the wrong way, now their lower back is going to be having to do more work, which causes some irritation within the core musculature and the muscles that stabilize the spine. Now, if the hips are very tight, right, and if you don't have, if you're lacking on flexibility or even mobility within the hip musculature, you're going to start utilizing lumbar spine excessive movements. So a couple of things that you can start to do is start working on seeing if you have proper hip flexion or you have proper hip extension. If you lack on any of these movements, or that's really hard to do for you, remember, you're going to start working that lower back and you're going to start creating that strain that we just don't want to have. So we're working, the hip is a ball and socket. If it doesn't have a range of motion, or it lacks in control in one of those areas, in one of those motions, the lower back is going to start adding movement to those areas in order to start to compensate for the deficiencies. So remember, hip is forward flexion, hip extension, abduction, adduction, and then rotational patterns that we have. We have horizontal abduction, we have extension, internal rotation, external rotation. We want to make sure that we have all ranges of motion. One of the things that we do here at Shift is we check to see if you have passive and active range of motion to ensure that your lower back is not suffering from doing all of the work. It can come from not just above or not just below, but it can come from above as well. The area of the lower back, it can be controlled. So you have a lat muscle, let me turn on your side over here. You have a lat muscle that starts at the front part of your shoulder here, and it goes down to the back into your lower back area. That muscle rounds out your shoulders and pulls down this way. Now, if you can't get your arms overhead, your chances are you're probably straining these postural muscles that are supposed to extend you back. So if you lack in range of motion here, and you're starting to ignore these signs that you can't get your hands above your head, one of the things that can be affected here is your lower back. It can strain, it can tighten up. Now, we don't want to go too far down a rabbit hole with this, but you know, you can tighten up your lower back and all of a sudden create better range of motion with your shoulder. So give it the opposite effect. Make sure that your shoulders are treating your lower back well by allowing it to raise overhead. You can grab a bar, you can hold on to something overhead, and you can just lean down, you can hang, and then make sure that those muscles allow those lower back muscles to help out, okay? So raising your hands overhead, hanging with your hands over your head can all help decompress the spine, can also help with ensuring that the spine is doing what it needs to do, which is being stable.
Here's one where it's a common, call it myth, that if your lower back is always hurting, maybe my abs and my core is weak.
Oh, yeah.
What do you think about that?
Yeah, no. So it's not necessarily that your core is weak. And I tell my patients this all the time. Your core is not weak. Your core is doing a lot of work. It's just trying to do too much. A lot of the time, lower back pain stems from elsewhere in the body, which could be above or below or even below. And so it's a mechanical thing that may be a problem. So when we look at the biomechanics of the spine is not, if the lumbar spine is supposed to rotate, it's supposed to flex, extend, it's supposed to have all of those motions. It's supposed to have control in all of those motions. However, if it's not getting help from elsewhere in the body, such as like the hips, like we talked about how the hips have so many dynamic ranges of motions, if it's stuck in one area and it's not getting the most amount of movement there, the lumbar spine is trying to work more for those legs. Now, in neurology, we also know that the more we utilize our extremities, we know that our core actually activates more than if we were to just work on the core musculature. So biomechanically, it's not that it means that your core is actually weak. It means that your core is probably doing too much. Work it from the extremities, and your core will actually get stronger.
Yeah. And you know how when people are like, oh, I got to do my ab work. Well, it works the same way. You're doing too much ab work. Now what happens? You have this because it's tight, right? Yeah. So look at what happened to my posture.
Yeah.
Right. So
yeah,
that's always been
such a big misconception.
Yeah.
Misconception is that, oh my God, we can see what perfect lumbar spine is going to be. Perfect lumbar spine. How do we measure that? How do we check to see if they have a perfect curvature within their lumbar spine? And most people just say, all right, drop your rib cage down. Now we have a perfect flat back, or we have a perfect curvature within our lumbar spine. It's a guess. We don't know that for certain. Our goal here at Shift and with Nexus is we are trying to ensure that our patients are empowered to know that the lumbar spine can be in a neutral space when we move naturally, right? How do we know that our neutral spine is not already at this point where I'm standing, right? So we need to get x-rays, we need to get MRI, we need to get advanced imaging. That's not necessarily something that is accessible to everybody. And so what we want to do is just kind of work on ensuring that we create better movement based off of our dysfunctional patterns that we see.
So basically, those are a handful of things that you guys can take note of for yourself, or maybe even some loved ones, that could potentially lead to lower back issues. So just pay attention to those. If you really have questions, come on in to Shift and we'll be able to help you out with that. If there's any other topics you guys want us to talk about, please let us know. Comment below, like, subscribe, share this with everybody, and we will see you at the next episode.